Good afternoon, and thanks to everyone for joining us today, and for those that are watching from home. I hope that everybody is staying safe and healthy. I know you have one thing on your mind, and that's vaccine, so let's turn right to that. First of all, I want all of you to know that I understand your frustration. I know you're out of patience, and I am as well. Everyone across the country is tired of the pandemic. We all want to put COVID behind us and get back to normal. We know that vaccines are the way out, and everyone wants to get their shot now, and I get that. You deserve to know what's going on and what happens next. So today, we're going to talk about two major things. We'll talk first about how we are accelerating Virginia's work to get more shots in more arms faster. That has to do with supply and logistics, how we move that inventory around to get it in the right places. Then we'll talk about how Virginia is significantly expanding transparency, so you can know exactly what's going on. So let's get to it. I want to start by reminding everyone where we are as a country. The first shots became available in this country in the middle of last month. We told you then that the first shots would go to the people who are most vulnerable, healthcare workers and people living in long-term care. We estimated that to be about 500,000 people. Today, about a month later, more than 520,000 shots have been given in our Commonwealth. It's important to know that. It means that we are on track. It's also important to know that in just 1 month, more people have been vaccinated than have tested positive in the entire year of the pandemic, and that is good news. It's also important to remember how the system works. The federal government contracts with drug companies to manufacture vaccine. The feds then allocate doses to the states, and we then distribute them to hospitals, clinics, and others to give shots to people. You'll recall that we laid this plan out for you at a press conference not too long ago, and we said then that everyone should expect things to be bumpy at first. Let's talk about one reason why that is. People can get shots only if we have shots to give, and there has been a lot of uncertainty about that, especially over the past 2 weeks, and I'll give you an example. 15 days ago, the outgoing Federal Secretary of Health told states, open up eligibility to everyone 65 and over. We'll send more doses. If you don't expand eligibility, we'll reduce your supply. Then 2 days later, states learned that there were no more doses to release. That made a confusing situation even more confusing across the entire country. So it's not surprising that places that had doses held on to those doses. That led to a reality that is both too much supply in some places and not enough in others. That's true in Virginia and around the country. I'll tell you in a moment how we're dealing with this inventory management issue. But first, you need to know how this is being addressed at the national level and what our federal partners are doing to expand supply available to states literally starting tomorrow. I've spoken with the White House twice in the past week. Yesterday, I joined a call with the White House and governors of the 50 states. And what I heard was states dealing with all the same issues we're dealing with here in Virginia. Not enough supply, not enough transparency, lots of logistics, and not enough time to plan. I also heard something that I have not heard since the pandemic began, and that is a commitment at the national level to work together, find solutions, and get this moving so we can all get back to our lives. I heard a spirit of bipartisan cooperation. Big states, small states, red states, blue states, East Coast, West Coast, and the Heartland. I can't tell you how relieved I was to hear that. The White House told us two pieces of good news. First, states are going to receive about 16% more doses immediately. That starts with the orders we will place tomorrow. Second, they're locking in this increase. So instead of being forced to operate week to week, we will now be able to plan out a month. This is really good news, and it's one critical part of our plan to get more shots in more arms more quickly. But being able to do that and being able to plan a month ahead all depends on having a stable supply and trust that the supply will continue to roll in. So we turn to General Gustav Perna for answers. He is the Army four-star general who leads the federal supply effort. We asked, how can we be confident that we will receive these additional doses in the weeks ahead? He told us that after more than a month of working, the drug manufacturers have hit a stable, regular, sustainable cadence of production, and that is good news. He is confident they will deliver the doses they have committed to the nation, and that's why he and the rest of the Biden team are making the decision to allocate more doses to the states. And as we heard in the news media, this is one critical step that will allow all Americans who want a shot to get one by the end of this summer. That's our country's goal, that's Virginia's goal, and Virginia is prepared to deliver. I got off that call and met with our team. I told them, this is good news, this is our goal. And I said, people are counting on us to work harder and faster to meet it. So let me tell you,